Well, greetings again. This is Dr. Bill Wyatt with the American Orthodontic Society, and I want to introduce a new channel in orthodontics here on introducing Pediatric Orthodontics with Dr. Bill Wyatt. Now, when I started out first doing orthodontics, and by the way, I've been doing this for nearly 60 years, and I started in working on children. I went to a small town in 1955, and it was kind of out in the edge, and there was no pediatric dentist. There was no orthodontist in there. There was just a lot of kids in there, and no dentist to take care of them except the one I was starting in 3 different towns, and there they had no dentist at all. So I started out in a rip-roaring practice and I had all these kids that I saw, so many of them, and I had to come up with something that would help prevent some of the bad orthodontic problems that would develop in there. So I came up with this technique of reducing the deciduous teeth and doing pulpotomies on them, and this way we could take the crown of the tooth down but leave the root of the tooth in. And I'll show you, if you extract the lower cuspids when you've got crowded lower anterior teeth, there's no way you're going to keep the other teeth from sliding forward into this gap where the root was. You want to keep the deciduous root there. So the permanent teeth are more narrow on the roots, and then they're wider as you get to the crown. So we took the deciduous crown of the cuspid down and did a pulpotomy on it, and then nature straightens these teeth out. I'm going to show you. We have a complete deal of this, and you're showing you how to do every step of it. And nature straightened the teeth up. I mean, the tongue pushing against them, and the lip catching it right in here. And if you get a child that's swallowing properly and breathing through the nose, and has no deleterious habits of thumb sucking and tongue thrusting and different things like that, you can guide the permanent teeth coming into the mouth and almost not need to do any orthodontics. Now you can come back later and touch up some of them. Some of them we would do, and they didn't need any orthodontics other than just what nature took care of there. So let me get in here and show you I'm just going to show 3 cases here of pediatric things, and if you're interested in pediatric orthodontics, you can go into just pediatric, this introducing pediatric orthodontics, Dr. Bill Wyatt. And so that'll be the title of the deal. Let's get started on it now. I'm going to have to get this first. This is just going to be a little bit of 3 different cases of things that pediatric dentists should know how to do. And I don't care what they say, pediatric dentists are capable of doing this. And this is ectopically erupting 6-year molars, and all that word means is that you got a permanent tooth that's erupting into the bottom of a deciduous tooth. It would be the second deciduous molar right in here. And so you can see that 6-year molar leaning like that comes underneath here. The resorptive cells around the follicle of the 6-year molar eat the dental structure of that tooth away. I mean, just literally eat it away. And you can see in that picture up there where there's the distal root of that deciduous tooth is just literally gone. And I've seen so many ridiculous ways of trying to straighten this tooth out here, and they would come in and try to prise this tooth up by pushing off with a baby tooth, and the baby tooth's got one little root holding it in place. Now, that doesn't work. You've got to get your force from some other place to bring that tooth into alignment. Now, and so I've got brackets drawn up there, but all you need to do is just, if you just took a wire and wired it onto these teeth up here. I can't already reach over that far to draw it, but you can just put a wire on these teeth up here. Right, that's come across here with a wire on that, and bond it to the teeth, and now you bond a tube on the tooth, and we like to, when we use a tube, we like to use a rectangular tube so the wire doesn't roll around as you activate it, and bend the loop in it. And we've got this down, and I'll show you how to bend the loop and everything else in there. Now, if you have to work from the side of the tooth. Now, this picture right here looks like I'm on top of it, but really I'm over, excuse me, I'm over to the side a bit. I'm going to have to get a little drink of water here. I'm at the side of the tooth, and as you prise this spring up, we make a spring over here, and it's bonded on, and this goes down. You raise it up and hook it behind one of these deals, and as this tooth goes back, the roots are in the bone structure, and you prise it up, it'll just pull it right out of that hole, pull it right up there and line up. And this is something I think everybody working on children ought to know how to do this. If you leave it alone till they're 12 or 14, this 6-year molar gets completely up here on top of the bicuspid, and you got a real problem. And a lot of times it's not corrected at all. Now, as this goes up, this spring slides back right here, and this thing opens up. And so this is halfway up, and here it is all the way. And you keep that activation on it and bring this tooth forward right there. And this works every time. I have upright teeth, thousands of them. And I have never had one you couldn't upright. I didn't care whether they were 89 years old. You could upright tooth laying flat down if you want to. If you just take electrosurge and uncover the side of it a little, put a tube on there and put one of these springs on it. And we'll show you how to make the springs on one of our pediatric videos there. We have a ton of these pediatric videos. Let's go on now. This is lower second bicuspids. This is, every once in a while this happens. I'm going to dedicate this picture to Dr. Ed Gonzalez. He is a pediatric dentist in Florida and is one of our leading people in the AOS. And he is a sharp guy. I really knows this. And he was showing this day one time in a lecture, and he didn't have this down, and so I was sitting back there about half asleep, and I saw this, and I said, wait a minute, back up that x-ray. And I got up and showed how you really can do this. So you've got a baby tooth here, and it's holding up a baby tooth above here. If you extract this tooth will drop in here before this tooth can come forward, and it can't close in there. So you leave the first half of this tooth alone, and you extract the back half of it back here, and this part holds this tooth in place, and the tooth drifts in here, and you can call it driftodontics if you want to. And this was, I tried to get the guy that referred the patient to do this pulpotomy. Well, he was afraid, he didn't know how to do it, so he sent this patient to a oral surgeon who was a physician also. I mean, a regular doctor as an oral surgeon. And he didn't know how to do a pulpotomy on a deciduous tooth. He just ground it off and sort of waved a little zinc oxide eugenol over it, and the tooth didn't take. I mean, the nerve died in it, but it still worked. But I did not do this pulpotomy. I've done thousands of those things, and I know how you got to pack them with zinc oxide and eugenol. I mean, he mixed it up so thick and pat it out, and I pack it in there with an amalgam packer. Yeah, and so I'll show you how to do that on the next one back here. So this was done, but the packing of this was not done properly, and so this tooth goes. Let me go and see the next picture's on here. So this tooth more or less abscessed right here, just it was draining to the outside, and I saw it. And so this was not a pulpotomy that I did. And so it came in, the tooth had drifted though, and this part, even though it was abscessed, stopped the eruption of that tooth. This 6-year molar drifted all the way up to that point. So now we extract the remaining part of it, cleaned it out and everything, and this tooth is going to drift now over to here, and it'll come out. In other words, you can move that tooth up or just let nature carry it. It'll almost parallel the roots of that as it comes forward. As it leans over, you pressures on here, and that tends to bring your roots forward to some extent. If it doesn't, all you do is just pull on it and put some of that force pushing these roots up here, and it'll straighten it up in there. So let's go on now from there. All right, here we've got the tooth all the way there. And so we show the whole x-ray down here. This tooth moved in just like the others, and here the tooth is now in there, and it just darn near does all that without you doing anything to it. So you started working on it way back there, but you do this, and this driftodontics, it'll just come in. And just remember, you extract the half of the baby tooth, and that first half holds the upper one up, doesn't let it come in and block the movement of that, and then this tooth will come in. And I got up and helped, and I was embarrassed helping Dr. Ed Gonzalez in his lecture, but I'm going to dedicate this to him. He is a sharp pediatric dentist, and I have really admired knowing him over the years. Now let's see, I think we go to another case in here. All right, we have oodles of slides on doing this procedure, and I wrote this up and published it years ago, and that's how I actually got started doing orthodontics, when I published this article. Now you get baby teeth, and you can see the permanent tooth coming in down here. Let me erase that so you can look at it, and you can see the tooth. Now, if you give these permanent teeth room to come in, the body takes care of it. I mean, the tongue is going to move these teeth over here, and it's going to open this gap, and so we take this tooth down, and we take this one down, and we do pulpotomies on all of them. Now, if you don't know how to do a pulpotomy on a deciduous tooth, we never do the pulpotomies on an affected tooth. Just a live, vital, healthy tooth. And we can take a long stapled diamond burr or a long carbide burr, and you just sterilize the burr and everything, and you just come in and cut that tooth down, and now you just go right down in the canal and ream it, just literally ream the tooth out of there, and it will bleed, and you'll see the blood in down here. Don't try to blow it out of there, for God's sakes, and you don't even need to suck it out. It's better just to pack the zinc oxide and eugenol. Now here you take zinc oxide, and that's all that I use, just chemically pure zinc oxide and eugenol. Mix it and pat it out until it's so thick you can pack the stuff like enamel in there. And I mean, just like amalgam. I take an amalgam plug and go in there and shove it down. If it goes out the tip, that doesn't hurt anything at all. Just pack it in there. And I've done thousands of these teeth. I mean, you need to do 8 of them on each case you do this. We go back and take the deciduous molar back off here and do a pulpotomy like that. I don't show it in this, but it's in these videos. We're going to put all of these videos for pediatric dentistry on one channel, and then you can go different aspects of that and pick up, and they'll show you these videos how to do these various things in pediatric dentistry. And why in the dickens, I just don't understand why the Pediatric Society doesn't go in there and approve this and do this. Now, there's to my knowledge, there's not an orthodontic department in this country that does this kind of stuff right here. This is what pediatric orthodontics ought to be doing. What I showed on these other deals too. You got to learn this stuff, and you learn how to do it. And so we pack this down in there, and now the root of this tooth is going. You can look on the x-rays, it's still there, and it's alive on the outside. And the permanent tooth goes against that root, slides up and keeps it, and the body will move these teeth over. You got to do the same thing over on one side you do on the other, and these teeth will go to the center and center up the midline will line up on them. I mean, this moving the teeth sideways with the tongue. You just gave the crown of that tooth is much wider than the root, and the root will fit between the deciduous roots of the cuspid, and you need to keep the deciduous roots of these, the root of the deciduous cuspid. That guides the permanent cuspid into that spot right there. Now let's get on with it a little and see. Now here this, and I'm not pulling your leg, I'm not trying to tell you something that won't work. This works. If you got somebody that's swallowing right, that's breathing through their nose and everything, the body actually pull that tooth up, pushed it in the line the tongue did, and as the permanent cuspid start in, you take the other one out and you do a pulpotomy on it. That's showing this complete deal. Now, this is, to me, is the best orthodontics that can be done. I mean, this is where the tongue push these teeth, and where the lips and the cheeks hold the teeth in place, and that's where they want to be. I don't care whose cephalometric stuff you use. This is what God gave you, and it is better than anything you can come up with telling you where to put these teeth. I can't hardly talk, but maybe you can understand what I'm talking about here, and I hope you get something from this. And if you're a practicing dentistry and you're in a place and you need help doing pediatric orthodontics, join the American Orthodontic Society. They can teach you how to do that. Thank you for watching.